Hi guys! So, now that we've defined the problem, we can build a plan on how to fix it. In the planning stage, we set goals for our patients, and these goals need to be SMART. You heard me, SMART. And what's a SMART goal? Well, it's S-M-A-R-T. A SMART goal is specific, measurable, achievable, relevant, and timely. When we say specific, it means that we need to define which aspect of the problem we are going to address in our goal. Measurable means that we need to translate the goal into terms that will allow us to know if the goal was met accurately or not. Achievable means that the goal needs to be realistic for our patient. In other words, we shouldn't have a goal that the patient will run a marathon if he's having trouble getting out of bed. Relevant means that the goal needs to actually be helpful to progressing the patient's care. If it's a patient who is able to walk around independently without any problems, the goal should not be to walk to the bathroom. It's not really a helpful goal to the patient. Timely means that we need to assign a specific period which will allow us to keep track of the progress or digression that our patient has made. It gives us a time frame for knowing if our interventions have worked. We should limit this to something like during my shift. By making it into a specific time frame, this lets us know where a patient is versus where we want them to be. The official NANDA title of these goals is Nursing Outcomes. So whenever you see nursing outcomes, think SMART goal. Now, each nursing outcome needs to have several coinciding nursing interventions which will allow the patient to reach the SMART goal. And the nurse is going to include these interventions in the planning stage. In other words, the planning stage also includes writing down the interventions that we're going to carry out in our next step, intervention. Basically, we can think of it like a treasure map. The nursing outcome is the X that marks the spot, and the nursing interventions are the directions like turn left at the fire swamp that leads you to the goal. It's important to note that all of our interventions must be supported by studies and relevant data. This is because nursing prides itself in being an evidence-based practice profession. At least while you are in nursing school, your textbook will most likely be the main source of rationales. Let's use an example to explain what we mean. Let's say we have a patient who's recovering from surgery. His name is Tom. Tom is going home in a day or two and needs to know how to take care of his surgical wound once he leaves the hospital. Using ADPI, we first assess the situation. After talking with Tom about his wound and gathering information, we determined respectfully that he does not know the signs and symptoms of infection, and he does not know what to watch out for once he's out of the hospital. We develop a nursing diagnosis of knowledge deficit related to wound care, as evidenced by a patient unable to identify signs and symptoms of infection in his surgical site. We now develop a plan using nursing outcomes / SMART goals. We set our SMART goals. We decide that by the end of the shift, Tom will be able to state 4 signs and symptoms of an infected surgical site. This goal is SMART. And let's see why. Well, first of all, it's specific. We are speaking specifically about signs and symptoms of an infected surgical site. Next, the goal is measurable. We listed a specific number that will let us know if Tom met the goal or not. We said that he will be able to state 4 signs and symptoms of an infected surgical site. 4 is a very measurable goal. Next, we know that this is achievable based on our assessment of Tom, and we are confident that Tom is able to achieve this goal. Next, the goal is relevant. Identifying an infection is connected to Tom's situation and care. Finally, it's timely. We stated that we want to reach this goal by the end of the shift, so we've listed a specific time. Now we must develop interventions to match this goal. What do we need to do so that Tom reaches this goal?